Welcome to Modern Dental Solutions, the home of complex and exceptional dentistry. Today we're looking at this case here. The patient is now 78 years old, and we began his treatment 18 years ago by doing some implants on the lower area. So this area here, it's obscure on the 3D X-ray image because of X-ray scattering, but there are two implants here replacing 4 teeth in his lower front. Now this X-ray was to prepare for his upper treatment in 2018. And if you look at the upper jaw, failing teeth, gum disease, the bone has been lost and destroyed and damaged by the gum infection down to nearly the tip of the root around some of these teeth here. That's his upper right. Here, the bone has been very much destroyed beyond the tip of the root and just being held by a bit of gum there. And on his left side, again, this tooth here, extremely compromised with the bone significantly lost again down to near the tip of the root. And then he's lost several teeth here. And the tooth at the back here also just essentially hanging in by the gum rather than being supported by bone. And what you also realize is that up here is the sinus area of his upper jaw. And if we go to the next X-ray, so up here, we can see that this corresponds to his upper left premolar, and the bone is lost essentially to the tip of the root. Normally, it would come a lot higher, up to about here where my arrow is, and run across here, but significant bone loss. And if I scroll towards the back tooth, again, there's no bone around the 3 roots of that back tooth supporting it. And what you also see is this is the sinus cavity here, and from the sinus cavity to the bone remaining is extremely minimal, only about 4 millimeters or so. So we're going to have to do something about that if we want an implant in there. If we look at yet another cross-sectional 3D X-ray image, you can see the bone destruction over here, and this here is a root fracture because of the tooth was so poorly supported at the top, and you can see the bone loss very significant here. The front tooth here, you can see the bone is totally lost around it, unlike the teeth that have bone where it's all white around the root. These have lost a reasonable amount of bone, but they can be kept for a prolonged period, and so we aim to maintain those. This tooth here, again, as we were explaining before on the 3D image, this tooth here is no good. Bone lost to essentially the tip of the root, and same with this tooth right at the back on his upper left here, not really supported by bone. And you can see the floor of the sinus is just here, so the bone in this area is absolutely minimal. And we let's go to another cross-section of the 3D X-ray. And in the third plane, we can see how much bone is lost around the front tooth root here. And if we scroll, we can see similar bone damage and loss around the premolars on his upper right, and similar bone loss around here. You can see this big dark area of infection and bone that has been damaged and destroyed, and a similar concept around the molar on his upper left. Okay, so subsequent to extraction of the hopeless teeth, so the front tooth here has been extracted, the bad teeth on this side have been extracted. We've only kept 4 upper teeth. That tooth that was bad here and this tooth up here was extracted, and you can see evidence of bone grafting, bulking out the bone ridge here, and similarly grafting in this area here. And we didn't do any significant grafting on his upper right side because the width there was adequate at the time. Okay, so if you look at now this screen here of the 3D X-ray cross-section, you can see where we've grafted the bone. The bone at the front tooth here normally would have been significantly lost there, but this really dense white area indicates the grafting to maintain the bone ridge in a reasonable contour. Much the same over here where the upper molar was lost. We've grafted that area there, and we've grafted a little bit along the edge here. Now, if you look at one of the other sectional views of the 3D X-ray, you can see here we've grafted that front area here, and that dense area of white here is indicative of that. Over here we've grafted that area of the ridge where the root was sitting there and the bone was damaged. But also up here, importantly, we've done a sinus graft procedure and increased the bone quantity and volume in this area significantly. And in yet another sectional view in a different plane, we can see this is the front area here, and this dense area here is where we've grafted the bone significantly to maintain the nice bone contour in the area. And then if we move right along, you can see bits of bone being added on the outside here and more here. And as we go towards the back, you can see the sinus graft in the other plane here. So increase the bone significantly. Normally the bone, the sinus floor would be here, and so the bone from there to here would be very inadequate for placing an implant. So now we've got reasonable bone for our implant procedure, and let's have a look at the implant result. Okay, here is the X-ray immediately after the upper implants were placed. You can see here the nice grafting of the sinus, providing us with significant bone in this area for this long implant. You can see that the implants are placed in very good alignment with respect to each other. This is all done without a guide, a surgical guide, or by eye-hand coordination. And this was in May 2019, and you can see the lower implants down here that were placed much earlier than that, and they're much the same now in the review x-rays. Okay, so 7 years after the upper implants, the front implant and the back implants were placed, and about 18 years after the lower implants were placed, so 18 years, that was June of this year, June 2026, and you can see this is his smile, and we've maintained 4 of his natural teeth quite nicely, and we've restored the others and his function using implants and the crowns and bridges. Okay, so this is a close-up photo of his upper front tooth. This is the implant tooth right here, looking quite good considering the circumstances. We always knew he had gum disease. We knew that he had gum recession and these black triangle issues. But despite him not coming back for regular maintenance at all, he returned in June this year for a check and clean, and he's been able to maintain these reasonably well relative to everything else. The implants are looking good. Over here you see this is an implant, part of an implant bridge, and the gums are looking quite good there as well, considering he hadn't been anywhere to be maintained and looked after properly over the last 7 years. And his lower teeth, the lower implants are actually 18 years this June, so quite a significant milestone there. So this is the x-ray we took in June, and you can see this is his lower 2 implants supporting 4 small front teeth. Bone levels are very good considering 18 years in service. And if we look at his upper x-rays, also the bone is very good. Upper front tooth bone extremely good around the implant there. All of them are doing very well. This x-ray is a bit dark because of the relative contrast of this big zirconia bridge that prevents us from seeing this very clearly. But everything is in good order. So if we have a good look at his complete upper arch, you can see the gum contour is reasonably good. There's no gum issues, no gum infection on both sides, and they're doing very well. So very successful case considering the length of durations he's had them in for and his lack of continuing maintenance. See our other cases on our Facebook page. We take care of the entire process unless you are referred for a specific surgery or procedure. Remember, when choosing a dentist for complex work using social media, make sure that they can provide you with a diverse and abundance of examples of their work, as we do on our Facebook page. Modern dental solutions for all your emergency and pain relief, root canal therapy, complex dentistry, extractions, dental implants, and bone grafting needs. All photos are taken by an iPhone or a Samsung phone or a small 12 megapixel handheld camera. Photos are not modified or enhanced except for cropping and labeling.